So I am Mani Bhandari, working with all the three organizations, and I'm supporting DeerghAayu for running these educational wellness programs, which are only wellness educational programs. We always give a disclaimer that always consult your doctors. These are not, descriptions or anything which we'll discuss today on this platform. This is all educational purposes. Okay.
Okay. Okay. So I first have to tell that I'm a retired cardiologist, internist, not a psychiatrist, nor a neurologist. So I will be talking on a subject which is as alien to me as it is to you. And whatever we are talking here is not in the form of an advice or should not be taken as an advice, but it should be taken as a review of literature. And that's what I have done. That I went into NIH and I jotted down few things, and that's what I'm trying to present. So whenever you suspect that something is wrong with your relative or with yourself, you should communicate with your treating physician, who is a licensed physician in Ontario, because since last 3 years, at age 83, I decided to call it quits and I resigned. So I don't have a license anymore. So whatever we are talking here is not should not be taken as an advice. It should be taken as a review of literature together. Is that very clear?
Yes. Thank you. Thank you, Dr. Vadekar, for joining. And
okay,
yes, you got it.
So next, please. Okay. Basically, Alzheimer's disease is a form of dementia. That means there is lack of cognitive ability. That is, people who get the Alzheimer's disease, they develop problems with their cognitive ability. That means the abilities which have been learned recently, they are more lost. Abilities which are learned in the past, they somehow tend to retain it. It is a very common cause of dementia after age 65, because there are various kinds of dementias or various kinds of cognitive abnormalities, like boxers get it because of the repeated trauma to the head. Other people also get it, those who indulge in alcohol or those who indulge in street drugs. So they can also get a type of dementia. But this one is extremely common disease of loss of cognitive ability, that is the learned things which they have learned recently, and it is a very common cause of loss of these abilities after age 65. And there was a sudden increase in the incidence of Alzheimer's disease in 2016. There was a dramatic increase in the and what I have done is I have collected all this data and I have made PowerPoint presentations of these, and I will request Mr. Ranade to forward that PowerPoint presentation to you so that you have that for your reference. So if you see somebody that who has lost interest in his own surrounding, or if you find that he has problems in doing simple tasks of life, uh, like uh, just she was an excellent cook and now she cannot cook. So that is one of the things which can be noticed. Or interpersonal relationships, if they have suddenly become not hygienic, or not caring for their looks when they were pretty decent before to start with, suspect that there might be something wrong and consult your physician in this regard. So, whenever you notice any change in behavior, or inadequacy in behavior, normal behavior, then you should suspect that this patient might be, and he is 65 and older. So it is a very extremely common cause of dementia. 60 to 80% of all cases of dementia in USA are related to this particular slowly developing disorder. Next, please. Next slide. Next slide, please. Hi, Mr. Ranade. Next slide. Yeah, okay. So over 7 million people are currently living in America with Alzheimer's disease. And this number is projected to double by 2060. So this is a frightening statistics. And since 2000, the reported death from Alzheimer's have increased by more than 140%, highlighting a growing public health crisis. So that is the reason one should not neglect it, because if they are neglected, they don't look after themselves. And if they don't look after themselves, their health deteriorates, or they might run into severe problem. So it should be looked into. So if you suspect anybody that he may be, one of the common findings or common complaints that they will say that they are forgetting, like they are forgetting normal usual names or usual addresses, like I forgot today. But I don't think I have Alzheimer's yet, but there's a possibility, because I am after 85, things double. The rate of Alzheimer's goes from a certain percentage much higher percent after age 85, and there is a substantial increase at age 65. Next, please. The problems which you can notice is in the memory, in the language, that is their speaking might change, in their visuospatial discrimination, in their executive functions, in their attention span, and in their social behavior. So these are the things which you may notice that something has altered in the way of domain of the cognitive impairment, which you may notice. So either they will be deficient in memory, or they will not recall, or they will go into a room, which is not uncommon actually. you will go into a room and then you will not remember what you had entered this room for, which is not it is very common after a certain age, but it is not common in a younger person. So if you start noticing any of these modalities, a change in functionality, then you should suspect that there might be something wrong. And if it is he is an elderly, because it is usually a disease of elderly, there are few cases which can happen of Alzheimer's in early age, but normally most of the people suffer after age 65. And if you notice any of these things being abnormal, think about it, take the patients to the doctor, and they will then test him for presence or absence of Alzheimer's. Next, please. Okay. I'm least interested in showing you this slide because I don't want to make you a pathologist or neither a doctor. But basically, there are very typical changes noticed in the histopathology of the brain. Those are the hallmark of Alzheimer's disease. It's called as hallmark of amyloid disease, that is beta amyloid deposits. So that is an extremely common pathological finding, and I'm not going to spend more than a few seconds on this. So just go to the next one. The progression timeline of Alzheimer's disease is usually a preclinical stage when the brain change occurs. And one of the methods of detecting these brain changes is when you do a CT scan, and that you're not going to order it, your doctor is going to order it, and usually there is a huge waiting list for any MRI studies. So CT scan will show you that there is atrophy of the brain, and because the brain tissue atrophies, the ventricles become dilated. So this is a very typical finding that the brain shrinks, but the ventricle, which are the draining fluids, which are the cerebrospinal fluid draining, they enlarge because the brain has shrunk and there is so much of space left inside your skull. It has to be filled in, and that has to be filled. And so that's the reason, to occupy the same space, your ventricles dilate. It is divided into 3 phases: mild, moderate, and severe. In mild, there is a mild forgetfulness, trouble in planning or organizing object. In the moderate stage, there is confusion about location, needing. I knew somebody extremely close to me who suffered from this, and he didn't want to be pointed out that you were suffering from Alzheimer's. He used to, when we used to tell them, just tell the servant that in India that go and follow him while he goes out, because they don't like to lose their independence. So they resist, and they say, there's nothing wrong with me. You people are unnecessary thinking too much. So we used to tell our servant to follow him from a distance, so that he's not aware that somebody was following. And invariably, he used to, at some corner, he will not know which way to go, and then he will start asking people. And when we see, we told the servant that when you see that he's asking for directions, then go and help him out. So that is the moderate degree, and in severe, there is a total incapacity, means loss of physical abilities, difficulty in communicating, or difficult even sitting becomes a difficult chore. So even simple tasks of life cannot be performed properly. Next, please. Okay, this is the neurodegeneration of the brain, and the ventricles have become dilated. So don't spend, and the cortex has shriveled, and there are areas of what we call as deposits of amyloid type of deposit. So, let's go to the next one, because okay, the the risk factors which are associated with one is aging, then there is cardiovascular or cerebrovascular diseases, repeated head injury like boxers, sensory hearing loss is another peculiar symptoms which is associated with it. Diabetes is very much associated with it. Similarly, obesity is associated with, and environmental is like I told you about drug use, and certain medications can cause it, and genetic, like if you have a relative with Alzheimer's disease, chances of you getting Alzheimer's increases proportionately. You cannot do much about genetics, but you can do certainly about the cardiovascular disease, cerebrovascular disease, diabetes, and obesity, and smoking, alcohol, or drug ingestion. You can avoid all those things, and that will reduce your incidence of Alzheimer's. Next, please. There are various tests which they do, and I'm not going to spend too much time on this, because there's no point in you knowing. I will send you the slides so that it is kept as a reference for you. Somehow, Mr. Ranade preferred the slides which he made. I had sent him also another group of slides which I made, but somehow he preferred, because these are AI generated slides. These are generated through, I don't know which AI he used. I also tried to make it through ChatGPT. So basically, there are many abnormalities which they can detect. I told you one what was MRI or CT scan. Then there are certain biometric markers, and there is certain blood panels, and the blood panel is done to rule out other associated disease which are associated with Alzheimer's, with loss of mental capacity. So like severe hypothyroidism. So we don't want a person to be treated for Alzheimer's when he is actually suffering from something very correctable, which is hypothyroidism. Okay, so next, please. These people do require, unfortunately, there is no cure for Alzheimer's disease. There is no cure. Only thing, you can make it more comfortable to him, and he or she does require lifelong care, supportive care. And that is the reason supportive care becomes of primary importance, either given by the family or by the hired help. But there is no denial that uh, that this thing is necessary for uh, care of Alzheimer's patients. Next, please. Okay, this is this is just showing the increasing incidence of the and because of that, lot of research is going on Alzheimer's, because they haven't still found any cure, and they don't know how to stop it, and they don't know. They know that certain people suffer, and after certain age you get it, but for all practical purposes, because so there's a lot of research going on to exactly find out what we can do to make their life better, or to find out some cure for it. Next, please. I think I will conclude by I have just introduced briefly the Alzheimer's disease. Basically, it is a dementia, that is lack of ability to think clearly and to perform certain regular duties of life. I will not be able to answer most or many of your questions, because I don't pretend to be a neurologist. Neither I am a neurologist. I am a cardiologist, and my next subject will be much more appropriate for me rather than talking on this subject. But he requested, and I said, okay, if I will fill in the shoes. So I did to the best of my ability. Thank you.
Okay. Great. We really appreciate Dr. Wardekar for your presentation. Can everybody hear and see?
Yes, I can see the presentation. Yes.
Okay.
Thank you, Dr.
Okay.
Wardekar.
You're welcome.
Dr. Wardekar, thank you very much. And yes, there was a little confusion in some slides which were not brought in at the last minute. We were having a little trouble in taking care of that.
Okay.
But thank you very much for.
But send it to everyone so that they have it for their reference.
Yes, there are another set of slides which are very, very detailed, and that is something which I'll be sharing with every one of you.
That is what I had collected from the NIH.
Right. So that would. So let me start with my part, where I'm trying to present to you a methodology in which you can do risk awareness by yourself, do it yourself kind of way. I've done it myself, and I feel everyone should be making use of it because of many reasons. We'll come to that. So what I'm going to look at is, first of all, I'll just tell you about this risk awareness program that we plan to do during this year. We'll follow with that with the actual risk awareness steps, how to perform that. And then subsequently, I will hand it over to Christine for explaining you the Alzheimer Society of Toronto's support that you could get as patients, and also their program for Walk for Alzheimer, etc., what is planned for at the end of this month. So, disclaimer, like Dr. Wardekar said that he's not a neurologist. I'm not even a doctor. I'm not a doctor. I'm not a high-level AI programmer or developer. I'm basically a patient like you, but I have used extensively AI for my own health. And through that process, I have realized how useful AI tools are for our healthcare. Uh, I'm at the age of 75, and I started using all these tools about 2 3 years back, and from then on, uh, you will see what all things are possible, and we'll also try to provide you the help and support required to do it for yourself. So this year we are planning to run these uh, health awareness programs, wherein each program will health awareness roughly every month or 2 months we'll have something where we'll try to help you to make to analyze the risk and see where you are likely to get these serious diseases. Uh, Typically, all our existing healthcare system is designed for treating the treating someone who has got the disease. Actually, it is not very well planned out for providing you the preventive actions. So preventive medicine is not very well provided for. If if you get a heart attack, they will do everything possible and make sure that you are immediately getting attended to. But if it is an indication that probably in next 10 years time you are going to get heart attack, and if you go to a doctor saying that I'm feeling worried that after 10 years I'm going to get this, they will give you an appointment to see them maybe after 3 months, maybe after 6 months. And that is where it really loses the whole thing. Whereas now with AI, there is a possibility that you can actually get all these estimates done well in advance. Anytime you need something, AI is available. We are planning to do these assessment programs for Alzheimer's. We are starting with, then we'll have heart, cancer, then genetic risks and osteoporosis. This is something what we're planning to do until end of this year. Okay, so why AI? AI has already become fairly accurate in terms of its assessment. Already 93% accuracy is already achieved in case of Alzheimer's, distinguishing early stage Alzheimer's. And nowadays, we generate so much of health data that this kind of data, even with human understanding, it becomes difficult to manage. Whereas AI can actually use as much data as you have. More the data you have, better it can do it. So with your wearables and all such devices, you're go on creating such huge amount of data, and AI is ideal to make use of that. So AI, of course, it is available 24/7. It can provide you unlimited service. You can keep on asking whatever you have for unlimited period of time. In fact, it encourages you to ask you more and more. It is almost free. It is not entirely free. There is a subscription fee of some $20 per month or something like that. But it is as good as free. And then you can use it anywhere, anytime. Multilingual. Supposing if you are using this risk assessment, this whole thing for your parents or something, they don't understand English properly, it will translate it to your language, and they can continue using it. So AI is a good choice for handling that. That's what we are trying to pursue. Okay. What we have tried to establish is a do-it-yourself AI-enabled health risk awareness. So it consists of basically 3 steps of data preparation. You see, AI is of no use unless you provide all the data to that. It is just like going to a doctor and saying that, okay, I will not tell you what are my symptoms, etc. Doctor will be able to do nothing. Same thing with AI. If AI doesn't get all the information about what are your symptoms, it will not be able to give you the proper help. So we are going to show you these 3 steps of data preparation, and then there are 4 steps of what kind of uh, report and uh, uh, report and other information you can generate, some standard things that you can generate from AI that will be seen. Uh, and then finally, we are trying to make a few volunteers ready to help you when you are trying to implement, when you are trying to do it, this risk analysis. So the first thing in data preparation is medical history. So here is a link which actually which will take you to a form in which all the type of history you can actually provide. It will have some basic information like your age and sex and which part of the world you're living in, your ethnicity, things of that type. It will have family history. This is very important because in case you have in your family history of Alzheimer's, your chances of getting Alzheimer increases. Your current cognitive symptoms, whether you already are at a level where you are forgetting things, etc. Then your medical history in terms of what kind of medical conditions you have actually gone through. Medication review, which medicines you are taking, if you are whatever you're taking, lifestyle factors, whether you have regular exercises, what kind of food you do, etc. Sleep is an important factor where they actually say meds, that is these are the sleep is one of the 4 important factors for your longevity. Vital data is your blood pressure and those kind of details. Then there are some cognitive tests. There are some simple tests which are performed to identify whether you have Alzheimer's or tendency for Alzheimer's. Functional abilities and patient or family observations. Actually, a lot of things patient may not notice, but their family will notice first. So this is a simple form it's a fairly long form, but it's a simple form that has to be filled in. So if you're doing this assessment for yourself, you can fill it. If you're doing it for any of your other family members, friends, etc., you can sit with them and spend some time. It will take a good 1 hour to fill in the entire form. Then the next thing is you can do some quick tests. These are very simple tests which are designed to be do-it-yourself kind of tests. Here you try to check whether you can recollect certain words and whether you have the correct ability to mark out on a clock different places for the hours and the hands, the clock hands, where they fit in. So that entire information is available again at this link what is provided over here. You will be able to get that document and perform this test. The last thing is that there are various different blood tests and other biomarkers which actually need to be collected in your in the lab. These lab tests, actually many of these lab tests are already available to you and probably are already taken when you go, say, for your annual health checkup. When you go for annual health checkup, they do many of these tests. So if these tests are available, you can make that also available to AI for looking at it. So this is the first step where you're doing data preparation. The next step is how to generate the reports. The first report, of course, is a risk estimation. Risk estimation, for that, the steps are simple. You upload your history form, you upload the results of your mini COP test, you upload the lab tests, whatever you are having, upload all of them, and then you can provide with it an example of what type of report you want, and then AI can generate with very simple prompt a report which is completely personalized for your requirements. So at that point of time, for each person, the situation is quite different, and it will analyze and give you that report. It doesn't only give you that report, it also gives you the additional guidelines of what kind of changes you should make to your etc. To your lifestyle, etc. So the next thing is, what you can do is that all this what has been done, actually AI can create a letter for your doctor, which states that okay, the purpose of the visit is that there is a possibility that there is a risk for the patient for Alzheimer's. Here are the summary of symptoms that have been observed and reported, and then it will provide you the questions and points to discuss with the. So this becomes very useful to tell you exactly what is. There are two things that are important when you go to a doctor. One is that you should be able to very precisely explain what symptoms you are having, and second thing is you should know what questions you should be asking about this whole thing. So all this actually AI can generate and give it to you. Then when you go to the when the doctor has seen it and he has given you some guidance, or even if you're not getting the appointment for the doctor, because typically you will require multiple months to actually get an appointment with the doctor to talk to you about this risk. But AI can generate a lifestyle prescription. You see, the risk factors are many, out of which some risk factors are something that you cannot do anything about. For example, age. Age is a major risk factor. Now, if your age is whatever, 70, 75, whatever, you cannot do anything about it. Your age is going to be that. But there are many risk factors which are manageable, like your nutrition, physical activity, stress, pain management, sleep. All these things are something that can be managed. And for that, the lifestyle is really a solution. There would be, of course, some medications as well, but you should really focus on your lifestyle, which is very important. And in my case, I never thought that I will ever have Alzheimer's. And when I got this report, it came out that I have high risk of Alzheimer's. Then I started finding out, and yes, actually my sister, who's another about 8 years older than me, and she had no idea. We were actually all thinking that she's the most fit person in our amongst our siblings. But all of a sudden, she started showing her symptoms of Alzheimer's, and then it was not even a matter of few months that she became absolutely dependent. And now, according to what information is being given, it seems that if you start really taking up preventive actions at an early stage, it is very likely that you would be able to postpone your actual Alzheimer impact by as much as 5 to 10 years, which is a very now. When I got this kind of a report and this whole thing, then it really made me doubly certain that I must do something about it. And I started very totally focused on my lifestyle ones, and I've now taken appointment for actually going and seeing the specialist. which I will get in another 1.5 months' time. I will get the appointment. I'll be able to talk to him. So this is something which everyone, I suppose, should do at least at the age of 60 plus. We should not wait until the last minute, because if the Alzheimer has gone in the at a late stage, then as Dr. Wondershare said, there is not really a cure. You have to just manage. People will just have to come and help you out. That's all. Nothing else can be done. So finally, the AI can put together something which can create a monitor. So what you are doing now, all your data gets captured with our wearables, like the digital watch, or you have those rings and all kinds of wearable devices. Those wearable devices are continuously collecting data. So that can actually provide you a good monitor of how you are doing it. So these are the things which we can do with this AI-based support. Now, all this actually, although what we are providing you is a do-it-yourself kind of a thing, but still, you need somebody's support to guide you, or at least to talk to somebody about what you're doing, how you're doing it, and to be sure about that. So for this purpose, we are trying to have a team of volunteers ready with us. Our team of volunteers will be someone who has already tried these all steps out and could be very easily helping you to do it yourself. So coming to this, actually, I will now hand over to Christine. She can talk about Alzheimer Society and the walk that is planned for the 30th May. After that, we are already coming close to 8, but then I hope whoever is having any questions, stay back, and we'll continue for another half an hour. So, Christine, would you like to take over?
Yeah, sure. And I'm just, oh, sorry, can you hear me? Or am I muted?
Yes, yes,
okay.
We can hear you.
I'm just putting in the chat a link for the walk, but I'll start with, so I sent you a slide deck. I don't need it, but if you want to put it up, I'm happy to follow along through there. I'll just briefly talk about what the Alzheimer Society does. And first thing I will note, there's a lot of talk about dementia, and we're called the Alzheimer Society. So I will say this: we support persons with all types of dementia, not just Alzheimer's disease. So it can be vascular, it can be frontal temporal, it can be any of the 100+ types of dementias that there are, we support. And you don't need a diagnosis. We know that a lot of people don't want the diagnosis. They know of someone who has it and they see the changes in someone that they know, and they're like, oh gosh, that diagnosis scares me. And so consequently, they don't go to the doctor because they don't want that label. So we don't want that to be a barrier. Anyone who comes to us, as long as there are symptoms that the loved one is noticing or is witnessing, observing, then they can use our services. So we do a few different types of things. We provide education for the general public and for healthcare professionals, so personal support workers, nurses, retirement homes, long-term care homes, because even though they graduate with their designation, we know, and I know from teaching certain jobs, that there's not enough, in my opinion, there's not enough education about what dementia is. And we teach it because we want people to know the signs and symptoms. More than that, though, we have discussions about these are the signs and symptoms, but this is what you do to support the person living with dementia. Our social work team, we do some one-on-one counseling. So that's not my department. I'm not a social worker. There's one-on-one counseling with social workers. Albeit our resources are fairly tight, so it's not unlimited time with social workers, but you have some time with a social worker so they can just help you through what you're going through, because we know that it is a journey and it's a hard journey. We have, if you go on our website, alz.to, there is a form that someone can, as long as you have permission of the person living with dementia, so it can be the person living with dementia or a family member, you can call, you talk with one of our intake coordinators to better understand your needs. And if it's not a service that we can provide, there might be an organization that we know of in the community that can help your needs. And for those caregivers, so we heard in today's session the importance of caregiving, and I did a lot of research surrounding caregiving, and it's a big job. These are people who are already doing many other things, their job, their own family. There's a lot of rewards to caregiving. There are a lot of challenges, and we want caregivers to feel supported. So we provide education to care partners. We also provide support groups, and we try to tailor our support groups to the needs as much as possible. So it might be there's a session just for spouses, or there's a session just for children, or a session just for care partners for frontal temporal, a specific type of dementia. So I've talked a lot about education and support, but you might be wondering, what about the person living with dementia? Yes, we provide support through them. We want them to lead as meaningful a life as possible. We want to keep quality of life at the forefront. So our active living team, we go across the city to keep them psychologically, mentally, cognitively, physically, and socially stimulated. We want them to feel a part of the community. We also do training with police officers and libraries so that when people are out about in the community, they feel safe. We don't want persons living with dementia to feel labeled or stigmatized. We want them to feel confident going out. We also want, if they get lost, for example, we want TTC bus drivers, as they're doing their route, to notice, oh, that person's been sitting there. They might look a bit confused. What should I do? So that is, in a nutshell, what we do. Our walk is coming up the end of May, so May 30th. This is our biggest fundraising event of the year. So in the link that I provided, there's various ways that you can join. In Toronto, this is a national-wide event, but every society has their own walk. So for us in Toronto, we've had to move because of FIFA. So sorry to the soccer fans out there if I'm not speaking positively about FIFA, but we're at Dale Park this year. So it's beneficial if you pre-register. So registration closes on the 28th. Not to say that you can't show up and register. It's just, it'll be faster if you do. We have organizations participating in various different ways. Virtual walks. Some people are registering teams, so you can rally your family, friends, and neighbors and fundraise together. We try to make our walk as barrier-free as possible, family-friendly, pet-friendly, and there's different routes you can take. A 1K walk for those who might find that enough, or we have a 3K walk. So again, that is on Saturday, May the 30th at Dalesview Park, and the link will show you different ways to register.
Thank you, Christina. That was really helpful, and we are having, a community of these people. We are also making a new WhatsApp group.
Oh,
to educate them, and if we have any questions, of course, we will handle that, and I can reach out to you for any other questions if we have. And we are trying to get many people and join this walk. Mm-hmm. As you mentioned, that we can also do it in our neighborhood. Yes. So I will research more on it and try to do that.
Oh, perfect. Well, we appreciate that.
Yeah. Let me add, we already have a DeerghAayu team registered.
Yes.
Oh, good.
Yeah. So and another thing I would like to do is that this would be a good time for all of us. I mean, we are on the webinar, but I mean, if you come for that walk, we'll be able to meet in person. And by that time, I mean, I'll be sharing this entire my presentation, which actually gives you do-it-yourself risk assessment part of it. So if you work upon it, try upon it, you have any problems in executing that, it will be a time, 30th May could be a time when we could actually meet in person and help you out to really make sure that you get your assessment.
And I will be at the walk. If you're walking at Downsview, I'm at the registration booth. So come say hi. Just remind me where you're from, because we meet new people every day.
Certain.
In cardiology, there is a lot to say about prevention, because it is extremely full of prevention, and everyone should get some risk assessment done on themselves, because that is one disease where a prevention, an ounce of prevention goes a long ways. And I wanted to provide to all of you with Framingham risk scoring and simple measurement of your waist size and simple lifestyle modification, which he alluded to. I'm not that much, I'm contradicting a little bit. I'm not that much for apps because those wearable things create anxiety, because my son calls me that my watch shows that I did not sleep well. and because of that, he loses sleep, because his watch is telling him that he hasn't slept well. So it has its own place, but as long as you do not become too much dependent, it does warn you. Like blood pressure monitoring, it is excellent for that. It is also good for your pulse rate. There's pulse rate fluctuations or irregularities. So those things are extremely good, but certain things I tell them not to look at it, because whether you slept or not, you should know whether you slept properly or not. Not your watch should not tell you that you did not sleep well. And that's why you feel extremely tired in the morning, because your watch told you not to, that you didn't sleep well. So that's just my note. But there's a lot to contribute from the when the cardiology session will start, and I'm looking forward to it, because there's a lot to do, which you can do your own, particularly Indians. They are at a very high risk of getting coronary artery disease or cerebrovascular disease or diabetes or hypertension. So all these can be looked after by yourself by doing certain risk scores, and you can determine whether you require to visit a physician to get a prescription of, or it should be looked into. Many times we hear that, oh, he never suffered, he never knew that he had a heart problem. He was jogging and he dropped dead. This doesn't happen. If you have done your proper risk scoring, you will know that you were at a high risk, and that's the reason you got the heart attack. Because a lot of people call me, oh, he was perfectly healthy, in good health, and he just dropped dead. One night, he just did not wake up from his sleep. So those are the things which are avoidable and correctable, and that is where my knowledge will help, will try to help you.
Perfect. Thank you. Thank you.
Not in the Alzheimer's. Very
But in
little.
cardio, yes.
The thing is that there's no cure for it, and once you have it, you have it. But So they do need social care, they do need identification, and they do need many other care, and they require it for lifelong. So, and how you should be able to cope with a person who has Alzheimer's in your family. So I have done this. I have dealt with it. I had someone as I gave you the example, told you, I had someone who you had to manage around them because they don't like to be told that they are suffering from Alzheimer's disease.
No, I agree on it. So thank you so much.
Yeah, there is one.
Yes, we have few questions here.
Yeah, few questions. So the
Ed,
this Mrs. RG, she's saying that I am also interested in cardiologist workshop. How am I going to know the date? We are scheduling it in the month of July, and the exact dates will be definitely communicated to everybody who's on this call, and more details about that.
Yes, we will be on WhatsApp group. We are forming our WhatsApp group. You can join, and emailing will be there.
So our active living team, we go across the city to keep them psychologically, mentally, cognitively, physically, and socially stimulated. We want them to feel a part of the community. We also do training with police officers and libraries so that when TTC, when people are out about in the community, they feel safe. We don't want persons living with dementia to feel labeled or stigmatized. We want them to feel confident going out. We also want, if they get lost, for example, we want TTC bus drivers, as they're doing their route, to notice, oh, that person's been sitting there. They might look a bit confused. What should I do? So that is, in a nutshell, what we do. Our walk is coming up the end of May, so May 30th. This is our biggest fundraising event of the year. So in the link that I provided, there's various ways that you can join. In Toronto, this is a national-wide event, but every society has their own walk. So for us in Toronto, we've had to move because of FIFA. So sorry to the soccer fans out there if I'm not speaking positively about FIFA, but we're at Dale Park this year. So it's beneficial if you pre-register. So registration closes on the 28th. Not to say that you can't show up and register. It's just, it'll be faster if you do. We have organizations participating in various different ways. Virtual walks. Some people are registering teams, so you can rally your family, friends, and neighbors and fundraise together. We try to make our walk as barrier-free as possible, family-friendly, pet-friendly, and there's different routes you can take. A 1K walk for those who might find that enough, or we have a 3K walk. So again, that is on Saturday, May the 30th at Dalesview Park, and the link will show you different ways to register.
Thank you, Christina. That was really helpful, and we are having, a community of these people. We are also making a new WhatsApp group.
Oh,
to educate them, and if we have any questions, of course, we will handle that, and I can reach out to you for any other questions if we have. And we are trying to get many people and join this walk. Mm-hmm. As you mentioned, that we can also do it in our neighborhood.
Yes.
So I will research more on it and try to do that.
Oh, perfect. Well, we appreciate that.
Yeah. Let me add, we already have a DeerghAayu team registered.
Yes.
Oh, good.
Yeah. So another thing I would like to do is that this would be a good time for all of us. I mean, we are on the webinar, but I mean, if you come for that walk, we'll be able to meet in person. Mm-hmm. And by that time, I mean, I'll be sharing this entire my presentation, which actually gives you do-it-yourself risk assessment part of it. So if you work upon it, try upon it, you have any problems in executing that, it will be a time, 30th May could be a time when we could actually meet in person and help you out to really make sure that you get your assessment.
And I will be at the walk if you're walking at Downsview. I'm at the registration booth, so come say hi. Just remind me where you're from because we meet new people every day.
Certain.
In cardiology, there is a lot to say about prevention, because it is extremely full of prevention, and everyone should get some risk assessment done on themselves, because that is one disease where a prevention, an ounce of prevention goes a long ways. And I wanted to provide to all of you with Framingham risk scoring and simple measurement of your waist size and simple lifestyle modification, which he alluded to. I'm not that much, I'm contradicting a little bit. I'm not that much for apps because those wearable things create anxiety, because my son calls me that my watch shows that I did not sleep well. And because of that, he loses sleep, because his watch is telling him that he hasn't slept well. So it has its own place, but as long as you do not become too much dependent, it does warn you. Like blood pressure monitoring, it is excellent for that. It is also good for your pulse rate. There's pulse rate fluctuations or irregularities. So those things are extremely good, but certain things I tell them not to look at it, because whether you slept or not, you should know whether you slept properly or not. Not your watch should not tell you that you did not sleep well. And that's why you feel extremely tired in the morning, because your watch told you not to, that you didn't sleep well. So that's just my note. But there's a lot to contribute from the when the cardiology session will start, and I'm looking forward to it, because there's a lot to do, which you can do your own, particularly Indians. They are at a very high risk of getting coronary artery disease or cerebrovascular disease or diabetes or hypertension. So all these can be looked after by yourself by doing certain risk scores, and you can determine whether you require to visit a physician to get a prescription of, or it should be looked into. Many times we hear that, oh, he never suffered, he never knew that he had a heart problem. He was jogging and he dropped dead. This doesn't happen. If you have done your proper risk scoring, you will know that you were at a high risk, and that's the reason you got the heart attack. Because a lot of people call me, oh, he was perfectly healthy, in good health, and he just dropped dead. One night, he just did not wake up from his sleep. So those are the things which are avoidable and correctable, and that is where my knowledge will help, will try to help you.
Perfect. Thank you. Thank you.
Not in the Alzheimer's. Very
But in
little.
cardio, yes.
The thing is that there's no cure for it, and once you have it, you have it. But so they do need care, they do need identification, and they do need many other care, and they require it for lifelong. So, and how you should be able to cope with a person who has Alzheimer's in your family. So I have done this. I have dealt with it. I had someone as I gave you the example, told you, I had someone who you had to manage around them because they don't like to be told that they are suffering from Alzheimer's disease.
No, no, I agree on it. So thank you so much.
Yeah, there is one.
Yes, we have few questions here.
Yeah, few questions. Yes. So the
Ed,
this Mrs. RG, she's saying that I am also interested in cardiologist workshop. How am I going to know the date? We are scheduling it in the month of July, and the exact dates will be definitely communicated to everybody who's on this call, and more details about that.